I would like to talk to you today about a very important framework and an example of co-creation, something that was contributed by the indigenous peoples as an alternative in terms of content, but also methodology. I'm going to talk to you about health determinants. First of all, the Alliance of Determinants of Health is reflection, and it's not an abstract model such as a platform rooted in. It's a platform rooted in real experiences. It was drawn up by indigenous peoples in the sociocultural regions to guide institutions and help them better understand how we see our systems and deal with the concept of well-being and welfare. And the aim is to guide them to incorporate their infrastructure and programs. An exceptional food systems summit and the framework recognizes food systems as intrinsic to health. They're at the center of physical, mental, and spiritual health and embody our intergenerational relationship with land, water, families, and the sacred. It goes above and beyond the absence of illness. It seeks to rebalance life dimensions and reconnect with everything that exists, as Amina said previously. Based on the UN Declaration on the Rights of all Indigenous Peoples, our framework calls for cultural security in politics and practices. These need to be inclusive, but also respectful laws, values, and systems of indigenous peoples. Through this perspective, indigenous food systems are protection factors linking community resilience, cultural continuity, and biodiversity. There can't be indigenous health without an indigenous food system, and there can be no food sovereignty without territories and natural resources. We need language, ceremony, and collective governance. The framework of determinants of health is mentioned in Decision 1619 of the Convention on Biodiversity, reasserting the role of indigenous peoples in the conservation and maintenance of biodiversity through traditional knowledge, indigenous sciences and customs, and features in the WHO report of 2025 on social determinants of health, and it recognizes the structural features and colonization as the fundamental cause of health inequality. Above and advocacy tool, the framework calls for a means of conceiving of systems so that world, national, and local leaders can be responsible for alignment with the objectives set out by the indigenous peoples, and so that they can implement these in an effective manner as a durable solution to an urgent situation. Food systems are a living example of risk factors of protection. This is our lives. These are linked to all aspects of indigenous welfare, health, or spiritual health through ceremonies and harvesting protocols and life cycles. These are fundamental and can be seen through the intergenerational transmission and learnings. Environmental health, seeking to optimize seeds and water. We need to revitalize food economies, and we need to reconsider practices and political health through sovereignty, rights, that emanate from treaties and the governance of land and water and natural resources. Together with all of these aspects, framework is a holistic vision seeking to protect indigenous food systems, but also to unleash all of the transformative potential by way of partnerships based on free consent, free informed consent, calling for structural reform. This framework is the result of 3 studies carried out by the Permanent Forum on Indigenous, the UN Permanent Forum on Indigenous Issues, and it provides guidelines on the structure, implementation, and assessment of Indigenous welfare. And the UN Permanent Forum on Indigenous Issues has recommended that all UN bodies adopt this. That's why we call upon all institutions, including the UN Organization for Food and Agriculture, to adopt this in their internal policies and to support indigenous means of governance of food, health, and biodiversity. When indigenous food systems are supported, diversity prospers, as does health, with adequate funding. Indigenous initiatives enable all of this to work, and the Indigenous Determinants of Health framework is an example of this. This needs to be in line with world priorities. As such, we need to incorporate this in our decisions for a better future for food systems. Thank you very much to all of you. I'd just like to recall that the current generation has a responsibility towards future generations. I'm a mother and a woman, and seeing children dying of hunger when their mothers are trying to run and find food for them is totally unacceptable. Food is a right. It's not a weapon to be used against the weakest people. Thank you very much.